Mâcon, France, September 13th, 2025. The quiet early autumn morning in Mâcon held a significance that went beyond the town's usual rhythms. For the first time since his appointment as Prime Minister, Sébastien Lecornu stepped onto the cobblestone streets of this Saône-et-Loire town to begin what he declared would be a journey rooted in the health and daily life of the French people. This was no routine appearance. It was Lecornu's debut on the ground as head of government, a carefully chosen moment meant to underline priorities, healthcare, proximity and reassurance. Cameras followed closely as he emerged from his car, flanked by local and national officials, setting the tone for a day framed as listening, observing and delivering. The visit began at 00:05 on the AFP TV timeline. Lecornu, dressed in a dark suit that contrasted with the bright September sky, was accompanied by Dominique Dufour, the prefect of Saône-et-Loire. Their handshake outside the departmental health centre marked the ceremonial start of the trip. At 00:13, he greeted Jean-Patrick Courtois, the mayor of Mâcon, who had positioned himself front and centre to welcome France's new head of government. Courtois, a veteran figure of the Les Républicains party, exchanged a firm handshake and a few words with Lecornu, a gesture symbolising both local pride and national acknowledgement. From there, Lecornu turned to greet a line of local elected officials. The gesture may have been brief, as captured between 00:17 and 00:22, but it was deliberate. The Prime Minister wanted to be seen engaging not only with national ministers, but with those embedded in the community. The walk toward the departmental health centre, filmed between 00:22 and 00:27, became one of the more symbolic visuals of the day. Lecornu was not alone. To his left was Catherine Vautrin, the resigning Minister of Labour, Health, Solidarity and Families. To his right, André Acquerie, President of the Saône-et-Loire Departmental Council. Yannick Neuder, also resigning as Minister for Health and Access to Healthcare, joined the group shortly after. This detail was telling. Lecornu's first trip was not only about his leadership, but also about managing a transition in health leadership. France's health system remains under scrutiny, and the presence of two resigning ministers underscored both the challenges and urgency of the portfolio. On the short walk, Lecornu stopped to talk with a resident. At 00:27 to 00:30, AFP TV cameras captured the exchange. Casual, unplanned, yet politically valuable. He bent slightly to listen, gesturing with open palms. Though the microphones did not capture every word, the image suggested attentiveness. By 00:30, the Prime Minister had reached the entrance of the Saône-et-Loire Departmental Health Centre. The building, modest but functional, became the stage for speeches and briefings. Catherine Vautrin, still formally minister, stood by his side. Yannick Neuder listened intently. Together they formed a tableau. The outgoing guard and the incoming Prime Minister aligned on the same stage. From 00:36 to 00:49, Lecornu and his ministers listened to André Acquerie as he presented the role of the centre. Acquerie spoke with the authority of someone who knows both the numbers and the human stories. Lecornu, arms crossed lightly, nodded at intervals, signalling engagement. The Prime Minister's presence here was carefully framed. Health centres like this one embody France's ongoing struggles with access to care, especially in semi-rural regions. Long waits for appointments, gaps in specialist coverage, and pressure on general practitioners have become recurring headlines. Lecornu's choice of Mâcon, not Paris, not Marseille, but a regional hub, was meant to send a message that he was listening to La France profonde. Throughout the morning, Lecornu's words were measured. He did not overwhelm with promises, nor did he dramatise. Instead, he repeated his central theme, proximity and daily life. At one point, standing before the gathered press and local officials, the Prime Minister made it clear, this first trip as head of government is dedicated to health and to the daily lives of the French people. It was a simple but pointed declaration, designed to anchor his mandate in something tangible and relatable. Catherine Vautrin, too, added weight to the narrative. As she prepared to exit her ministerial role, she emphasised continuity. What matters most is ensuring that the structures we have built serve people every day without interruption. Her words carried the tone of a caretaker, ensuring a smooth handover. André Acquerie, presenting the centre's services, stressed local relevance. This health centre is proof that territories like ours can innovate, adapt and respond to the needs of our citizens. Finally, Yannick Noida, reflecting on his time as minister, highlighted challenges ahead. Access to healthcare remains one of the biggest concerns for families, and we must keep pushing for solutions. Each statement, modest in length, fit neatly into the narrative Lecornu wanted to project: seriousness, continuity and local engagement. By 0059, the head of the departmental health centre took over, presenting the structure in detail. He walked Lecornu and the ministers through its services, explaining how patients flowed from reception to consultation and where specialists were stationed. AFP TV footage from 0105 onward showed the delegation entering the building, the camera panning as the group filed in. The Prime Minister, slightly ahead of the others, nodded as he listened. This part of the visit was less about speeches and more about observation. Lecornu leaned over counters, peered into consultation rooms and asked questions. Staff explained procedures, from digital record keeping to appointment scheduling. At one point, a nurse gestured toward a waiting area filled with chairs. The Prime Minister nodded, his expression tightening, an acknowledgement perhaps of the challenges of wait times. Beyond the visuals and the sound bites, the day carried broader political weight. For Lecornu, newly installed as Prime Minister, the visit was not only about health, it was about anchoring his premiership in everyday concerns rather than abstract policy. By choosing Mâcon, a city known for its balance between urban services and rural challenges, he situated himself as attentive to both France's heartland and its evolving healthcare debates. Observers noted that Lecornu refrained from sweeping announcements. Instead, he left with a promise of engagement. We are here to listen, to understand, and to ensure that health services remain at the core of our national priorities. This measured tone marked a contrast with some of his predecessors, who often used first trips to launch ambitious reforms. Lecornu instead leaned on symbolism, appearing alongside resigning ministers, local elected officials, and citizens, signalling that leadership for him begins with presence. On the ground, reactions were mixed but attentive. Jean-Patrick Courtois, the mayor of Mâcon, expressed satisfaction. It is encouraging that the Prime Minister chose our city for his first visit. It shows that the government recognises the importance of local communities among citizens. Views varied. Some praised the choice of health as a priority. Others worried about whether visits like these would translate into concrete improvements. One resident, speaking outside the centre, said quietly but firmly, "We need more doctors, more quickly. It's not enough to visit. We need solutions." As the delegation departed the health centre and cars lined up to return Lecornu to Paris, the day's symbolism became clear. This was not a grand reform announcement or a sweeping economic pledge. It was, instead, a carefully staged first step. The Prime Minister had placed himself in front of the French people with a simple message: that his leadership would begin with healthcare, with presence, and with attention to the ordinary rhythms of life. Whether that message will hold in the coming months as political storms inevitably gather remains to be seen. But in Mâcon, on this September day, Sébastien Lecornu managed to do what he set out to do: present himself not as a distant figure in Paris, but as a leader willing to listen where daily life is lived.
Pour l'élection, tout va bien, la prise de fonction se passe bien? Ouais.
Non, je tenais absolument à ce que ce
Message
soit...
de félicitations. Oui. Parce que j'ai 21 ans, c'est vrai que c'est compliqué. Vous habitez où?
On arrive à trouver des solutions. C'est pas parfait, simplement il y a 40 000 habitants à ce jour qui est là, on l'a écrit. Un clin d'œil à l'époque au directeur régional de l'ARS qui était de prendre leur retraite en 2018, 50%. Quand on prenait le taux de remplacement.
De vous déplacer au centre hospitalier de Mâcon pour notre premier déplacement. C'est vraiment un honneur pour nous.
On peut évoquer aussi, mais on viendra peut-être 5 ans, évidemment. Mais voilà, on l'a accepté.